Do medical therapy cause kidney stones? I'm Professor Frank Joseph, consultant endocrinologist and founder of Dr. Frank's Weight Loss Clinic. The answer to that question is that studies have not shown a direct causal link between medications on kidney stones. They're not listed in what's called the SMPC, which is the Summary of Medical Product Characteristics. Theoretically, however, if you're on treatment for weight loss using these medications, because you could get gastrointestinal side effects and become dehydrated, theoretically can lead to kidney stone formation. In addition to that, you often find that on these treatments, you are predisposed to having a higher protein diet, which is something we recommend to try and help you lose weight, which is the primary aim of these treatments. And on a higher protein diet, you have a risk of also having a little bit of extra calcium in your urine at the same time, which can predispose to calcium-based kidney stones. Finally, it's also important to realize that any fluctuation in glucose levels in the body, which these medications will affect, because that's partly how they work in terms of appetite control, but also glucose regulation, that change in glucose metabolism in the body can actually have a change or inflict a change on the urine chemistry in a way, and that can predispose to kidney stones. But having said that, in clinical practice, I have never really ever seen someone who's suddenly been treated with these medications and developed kidney stones. There are a few anecdotal case reports, but it's very difficult sometimes with single numbers to be able to make that association. As far as I'm concerned, from a safety perspective, you do not need to worry about kidney stones as there is no direct causal mechanism. If you have got any predisposition to kidney stones, you just have to make sure that you are treated under supervision, you keep hydrated, you watch your calcium intake, and you ensure that you are looked after on a regular basis by a professional who has an expertise in looking after patients with medical issues related to weight gain.